Welcome to the webinar on preventing and managing viral infections with Ayurveda. I'm very thankful to the Nepal Ayurveda Medical Students Society for inviting me to this webinar series. When you think of a viral infection and a treatment for it, the first question that comes to our mind is about, is there a medicine that can kill this virus? And it's a fact that we do not have medicines to kill many of the viruses that are known to infect human beings. We have to depend on, the immunity of the body, which can build up after a viral infection, or we have to develop a vaccine, or we have to look at antiviral therapies. So today I would like to present the perspective of Ayurveda on how to look at viral infections. But before we come to the Ayurvedic perspective, let us very quickly review our basic knowledge about viruses. What is a virus? So if you look at it from a scientific point of view, the virus, the single virus particle called a virion, it's just nucleic acid and an outer shell of protein. It's just genetic material, RNA or DNA. There are RNA viruses or DNA viruses. And these they have genetic information that can encode proteins, and they enter into the human body. They basically hijack our genetic material and reproduce themselves. So how does a virus affect the human being? Of course, these are extremely tiny particles that we cannot see them, and they are actually intracellular parasites, which means that once they enter our body, they find their way into the cells, and they have an affinity for specific host cells. So viral infection begins when the proteins on the surface of the virion, which it uses that to bind to specific receptor proteins on the host cells, and then it enters into the cell and then hijacks the genetic material and then replicates. And this affinity of a virus to a cell is very specific. So different viruses have different affinities. And all viruses do not, of course, affect the human being. A virus that infects only bacteria is called a bacteriophage or simply a phage. And viruses that infect animal or plant cells are referred as animal viruses or plant viruses. So I want us to think, in a very broad way about viruses. Of course, today in the scare of this global pandemic, the very word virus sends shivers down our spine. But we need to also look at viruses as not just causative agents of many diseases. Viruses are important tools in cell biology research, especially in studies on macromolecular synthesis. They are actually extremely tiny, machines, in one sense, genetic machinery, which serves very interesting purposes in nature. So let's come back to that as we move forward. Before that, there are certain interesting things about the viruses. Recent research revealed that viruses are literally falling from the sky. There are many viruses that get sucked up into the outer atmosphere and then fall out of the sky. So I'm just telling this for us to understand that viruses are all over the place. I mean, you cannot escape them. They are even moving across continents. This is what this particular study, which was published in the International Society for Microbial Ecology journal, reported. So these are done by scientists from Canada, Spain, and the US. And this is because we have been observing genetically similar viruses seen in different environments across the globe. And it was not understood how these viruses move around. I mean, how are they all the same viruses seen all over the place? And now research has revealed that a virus can be swept into the atmosphere on one continent and deposited on another. So billions of viruses and tens and millions of bacteria are being deposited per square meter per day. So this is a very, very active and dynamic world. And the deposition rates for viruses were 9 to 461 times greater than the rates for bacteria. So the viruses are really enigmatic because they are representing the border line between life and death. I mean, they are invisible, but they are involved in, very complex and very, intriguing activities in the external environment. And also, of course, it begins its real work when it is entering into another life form, be it bacteria, plants, or animals. So when we talk about a virus, we think it's something that has to come and attack us from outside. I don't know how many of us are aware that there are viruses inside our bodies. Just like there is a human microbiome, bacteria, we also have the human virome, which is the total collection of viruses in and on the human body. And only some viruses cause disease while many others are asymptomatic. So why do viruses inside our body do not harm us? It's because these viruses are actually, bacteriophages, because their job is to, infect and damage the bacteria. So inside the human body, we have to consider several viromes in different compartments of the body. There are distinct viral communities, and the virome is also part of the microbiome. So when we talk about the microbiome, we usually think about the bacteria, and as we will see that there's a big difference in the distribution and even in the population of bacteria and viruses that are inhabiting our human body. So when you look at the microbiome, all these things need to be taken into consideration. And so what's important to realize is that just because you don't have the flu, it doesn't mean that you do not have viruses in your body. So what are these viruses doing if they are not making you sick? In fact, this whole exercise of quantifying the microbiome is a very recent phenomenon. And we have now understood that the human body, these estimates are still, not extremely accurate. They are inhibited by at least 38 trillion bacteria. And more intriguing is that bacteria are not the most abundant microbes that live in and on our bodies. That are what goes to the viruses. The viruses are the most abundant, microorganisms inside our body. So if there are 38 trillion bacteria, then how many viruses are there? Now, this is quite surprising that, there are 380 trillion viruses inhabiting us, even when we are not sick. A community collectively known as the human virome. But these viruses are not the dangerous ones, the ones that cause flu or common cold, or even more dangerous, frightening infections like Ebola or dengue. These are viruses that actually destroy the harmful bacteria in our body. So the human virome is in fact our defense against harmful bacteria. So this is the irony. Today we are going to talk about how we are going to use our immune system to fight viruses that enter into our body. But before that, it's important to understand that viruses, another kind of viruses, the bacteriophages, are actually also part of our immune response. They are part of our defense system. So this is the paradox, this is the irony that we learn from modern science before we get into the Ayurvedic understanding of viral infections. Generally, the study of the human virome is lagging behind that of bacteria, and we are only beginning to understand because while the presence of bacteria in the human body was recognized much earlier, the human virome, has been recognized much later. So now is a question: how dangerous are viruses? Is one virus, which is such a tiny particle that we cannot even conceive that it exists, is one virus enough to cause infection? So until now it was unclear whether a virus must be seen as an individual unit that can infect a host independently, or do they work as a cloud of viruses, cooperating to cause an infection. So it is not yet known if the viruses that affect people can also act individually. So there has actually been conducted an experimental research with insect larvae in Wageningen University and Simon Fraser University in Canada, and theoretically it is now understood that one virus particle is enough to cause infection and subsequent disease. If one virus particle can enter your body and if it can infect a cell, then it can multiply. So what is the magnitude of this multiplication of the virus? We will look into that. So this is the point from where we will start looking at viral infections from an Ayurvedic viewpoint. So let's summarize what we discussed so far. A virus is a genetic code that hijacks the genetic material of our cells to replicate itself. The virus becomes active only when it enters the human body and also gets inside the cell. A virion, which is actually a single virus, one virus, it's so efficient that whenever it infects a cell, a single virion can produce about a million new virions. So it's a million viruses that comes out of an infected cell. So this is the scale in which the viruses multiply inside the human body, something we call as a viral load. And so from an Ayurvedic point of view, let us start now thinking it from an Ayurvedic point of view. If a virus is causing a disease, then how would we understand it? I'm not today going to discuss about what is a virus from an Ayurvedic viewpoint. Of course, we will, look at that question also in a very broad way. There is a difference between what is a virus and what is a viral infection. Viral infection is the net result of a virus entering into the human body. And what happens as a result of this interaction between the virus and the human body, the immune system, is what we understand as a viral infection. So our focus is today on actually the outcome of a virus infection in the form of a viral disease. So from an Ayurvedic point of view, definitely in terms of the origin, viral infections are having an Agantu origin. So it can be considered under the Agantu category. In fact, a viral infection is triggered or viral diseases manifest only when the virus enters the system. Now, even if we were to include viruses under the Agantu category, Agantu represents a wide spectrum of diseases ranging from injuries, allergies, mental diseases, as well as infections. It's difficult to find an equivalent term also for infection in Ayurveda. We also will briefly look at how does Ayurveda understand a virus, or did it at all understand what is a virus? So before we get into that question, I would like to bring your attention to the concept of krimis and the idea of avahana. So the concept of krimis in Ayurveda comes close to the idea of microbes. Krimis are of two types, natural and pathogenic. And when we looked at viruses also, we understood that they are of two categories, natural and pathogenic, and that we have about 380 trillion viruses in our body. And Chakrapani in his commentary on the Charaka Samhita says Aparisankheyatvad. The krimis inside our human body are aparisankhya, or you cannot even count them. They're so numerous. So we can also say that it was perhaps in these ancient textbooks that even the idea of a microbiome was first conceived. Now, what's interesting is like when we talk about krimis, we usually translate them as worms. But krimi in Ayurveda is an umbrella term. It it denotes both the gross as well as the subtle, organisms that are inhabiting or infecting the human body. So the classical texts clearly say that some of these krimis are microscopic. I mean, they are anu and invisible. Clearly, kejid saukshmya darshana. Arunadatta in his commentary on Ashtanga Hridayam very clearly clarifies that this is, you cannot see it with your mamsa chakshu or your physical eye, which means they're beyond the perception of the sense organ. So this is also a very clear indication that in those ancient times, even in the absence of microscopes, the ancient acharyas were aware of the existence of microorganisms. And in the context of Kushta Chikitsa, we do have an interesting idea of looking at infection. In the context of Kushta Chikitsa, it is said that when the internal environment actually undergoes some changes, then it creates a situation that is favorable, then the krimis, are invited. So the krimis come because they are invited, because we change the internal environment into a situation which was favorable for the krimis. So in Ayurveda, before infection happens, there has to be some changes in the host environment. And that is why infection is not looked at in Ayurveda as an invasion or an attack, but rather as a change inside the human body that invites microbes to come inside. So this is the difference between the idea of infection and avahana, and this is very important in our discussion today. This difference makes Ayurveda give more importance to the host-related factors in the management of infections. So even Louis Pasteur, once he said, if you consider the germ and the soil, we need in future to give more importance to the soil than the germ. And this is exactly the approach that we can see in Ayurveda. So many of the what modern medicine or science calls as infections in Ayurveda would be categorized as avahana, not as attack, but as invitation, is an inner change that has happened due to our negligence of health, and that's when the microbes come. On the other hand, there are also ideas of attack or infection in Ayurveda, but these are, discussed with reference to certain other entities called as bhutas and rakshas. Bhutas are beings that are not visible. They can enter the body and affect the mind. Even diseases like Vishamajara, which we today know is an infectious disease, are considered to be caused by Bhutabhishanga. So the infectious diseases which are virulent and in which a body which has not undergone any internal environmental changes, they also get affected. This is described in the context of epidemics, that in spite of the dosha prakriti or the internal condition of the individual, diseases can occur where everybody is affected in the same way. So Ayurveda has two ideas of what we call as infection. One is infection happening after changes happening inside the body, or infection that happens even when your body is comparatively, healthy and stable. So this is the second idea of attack or infection. And to prevent such diseases in Ayurveda, we have measures like bhutadya sparshanopaya, that is avoiding coming into contact, with the bhutas. Rakshas is also another concept, which means invisible beings from which we need to be protected. And Rakshogna karma aims to destroy the Rakshas. And, these are measures like dhupana or fumigation with herbs. And actually studies have shown that these dhupana or fumigation has microbial activity against both viruses and bacteria. Similarly, Krimigna Dravyas also have antimicrobial activity, and depending on virulence, we need to think of Krimis or Bhutas and Rakshas. And in the context of epidemics, Charaka in fact also discusses about Bhutas and Rakshas. So with this, I would like to, you know, stop our discussion on what is a virus. Ayurveda has some thought frameworks to understand microorganisms, to understand that some of them are harmless, in fact, helpful for the body, while these are called as the Sahaja, and then the Vaikarikas, which cause diseases. And infectious diseases could be either a process of avahana or an abhishanga. Avahana is when there are changes happening first inside the body, and then there is the entry of the disease causing microorganism, or situations where there are there is no significant change inside the internal environment, but nevertheless there is a entry of a microorganism which provokes diseases. So this is the backdrop with which I would like to go into how we Ayurveda approaches the treatment of viral infections. So the question here is that if we were to think of viral infections purely as an Aganduja disease, then our focus will completely be on the virus. So this is the kind of dilemma that we have to address when we want to treat viral infections. What are we going to focus on? Are we going to focus on the virus as a cause, and are we the main aim of our treatment, is it going to be to kill the virus, or are we going to look at the host factors, the internal factors of the body? So all infections are not Agandu in Ayurveda. This is what I was trying to say. And even in Nija Rogas, infection may be involved. So the criteria for Agandu or Nija is what happens first, the disease process or the dosha Vaishamya. So an Aganduja disease is where the disease process initiates before dosha imbalance occurs. And Nija Roga is a process in which the dosha Vaishamya happens first, and then the disease process is initiated, and infection may also happen at a later stage. So in many infectious diseases, the conditions in the host has to become favorable for the infection to produce a disease. Whereas in other situations like epidemics or pandemics, irrespective of the host condition, the infection triggers the disease process. So from an Ayurvedic point of view, an infection should be considered Agantu only if it is not much dependent on the host factors to initiate a disease. In fact, what Ayurveda says is that there is always an interplay between Nidana, Dosha and Dushya. So here, the agent of the disease is the Nidana, and the host is represented by Dosha and Dushya. So the interplay of the agent and the host, this in Ayurvedic terms is described as Nidana, Dosha and Dushya. So here the question is, what is it that we should give importance to the Nidana or the Dosha and the Dushya? So yes, generally speaking, viral infections are Aganduja Rogas because the transmission of the virus can initiate the disease in most cases, and hence the usage also viral. I mean that it just spreads and moves around. So this concept of viral disease as Agandu is very useful in prevention. We know now we are living in an age where we are witnessing a pandemic, and it all started with a few numbers, but today in one day nearly 80,000 new sick people are being counted all over the globe. So this is quite an ability of the virus to jump from one person to the other. So irrespective of their health, of course the outcomes may vary depending on your internal condition, but it's almost infecting all the people that come into contact. So as an Aganduja Roga, this is definitely important in prevention. So that is why avoiding contact with the virus. Sushruta has already explained the modes of transmission, prasangad, gatra samsparshad, and all those modes of transmission. So not be crowding together, not touching another person. Nishwasad, breathing through your breath. Sahabhojanad, if you socialize and eat. And that's why today we are also practicing social distancing. This is very, very clearly mentioned in our texts. When diseases have this agantu component, then we have to practice all these measures to contain the spread of the disease. And in fact, Sushruta also advises sthana parityaga, which is kind of a lockdown thing. We are not allowed to move into places where there is a risk of contracting the disease. We are made to sit in our home. This is called as sthana parityaga by Sushruta. So Sushruta was perhaps one of the first advocates of a lockdown measure to mitigate a pandemic. And the concept bhudadya sparshanopaya, not touching, not coming into contact with these agents that can cause disease. I'm not going into the question of whether which is a virus. Is it a krimi, or is it a bhuta, or a rakshas? That's not so relevant here. That requires another discussion. I mean, a lot of debate. I mean, in this short lecture, it's not possible to address these questions. But what I wanted to point out is that if we look at the descriptions of krimi, rakshas, and bhutas, we get all the principles that are needed to actually deal with viral infection, at the level of the transmission, at the level of what you call as community transmission or local transmission, or even an individual infection. All these concepts have been well explained in these thought frameworks. And it's also found that rakshogna karmas like dhupana help in mitigating to a great extent. We need to study how these dhupanas or fumigations work on specific viruses or microorganisms. But already scientific research has revealed that they are helpful and they are able to reduce the microbial load in the environment and the surroundings. So with this kind of sort of introduction, I want to say that when it comes to treatment, when it comes to preventing spread, transmission, we need to look at it as agandujaroga. But when you are looking at an individual patient with whom you want to treat, of course you have to wear a mask, you have to keep a distance, you have to isolate, all those things are there. But that will not help an individual. So looking at virus as an agandujaroga helps it from spreading in society. But if you want to help that individual who has contracted a virus, then you have to look at the disease, now as a nija vyadhi. Which means when you say agandu or nija, it only means that you're shifting your attention from agent of the disease, that is the outside, to the host, which is the biological system, and how the biological system is going to deal with this virus, and how you can modulate this interaction between the agent and the host. This is really the focus of Ayurveda in managing viral infections. So now we are going to look at the whole thing from a point of view of medical management. We have to focus on host related factors here, like Agni, Srotas, Thana, Bala, and Dosha. So here I want to give a simplified framework for us to think on how we can deal with viral infections. I'm not here talking about very specific individual protocols or medicines. That could be the topic of another discussion. This is kind of an introductory lecture, setting the theoretical foundation and approach in Ayurveda. I don't want to just give you some herbs and say this is antiviral, this you can use this formulation. Because, viruses are mutating, that. And the more we try to, conquer them, the more they change. And this is the advantage of Ayurveda, that we have a mechanism where we can adjust our medicines according to the viruses. And we have studied the host factors in such a way, which is what we must do also when a new viral disease manifests. And for this, we need to have access to patients. We need to work on patients and very closely study the symptomatology. And then it would be possible for us to actually understand, what changes are happening. For us, it's not just the virus that we have to destroy, but we have to actually understand how the body is responding to the virus and then optimize that response so that we can overcome the infection without leaving residual problems. So before viral infections come, Ayurveda definitely says, Charaka Samhita, when clearly instructs that the real care has to be taken before an epidemic manifests, or in the very early stages, the moment you begin to realize that that's an outbreak and this has a chance of spreading. Charaka says that we must start up using rasayanas to enhance immunity. So this idea was there in the Charaka Samhita, that the best bet to deal with an epidemic is to enhance the immunity of the individual. And for this, Charaka has advised rasayana treatments. So the rasayanas enhance the bala of the body in anticipation of possible viral infections during seasonal changes or outbreak of epidemics. It's really interesting that Charaka does not advise medicines at that point, because he clearly says that the medicines which are available at that point of time might not work on that epidemic. You will have to really discover new medicines, and that is why Charaka warns that before the epidemic gains that momentum, you have to actually enhance the immunity of the people to kind of mitigate the impact of the epidemic. So once the infection sets in, and once you are going to have individual patients whom you have to treat, I mean, we cannot just think about the virus. Now we have to think about the host factors. Nija Vyati. So this is beautifully described in Ayurveda, that Agantu Anvedi Nijam Vikaram. Even though a disease begins as Agantu, after a stage it takes on the characteristics of a Nija Vyati. Similarly, Nijastad Agandhurapi Pravruddha. A disease may begin as a Nija Vyati, but eventually it can also, be involved with factors that work from the outside. So this Nija Agandu division is a continuum. It's not a compartmentalized concept in Ayurveda. Similarly, just because there is an infection, that's not the criteria to classify diseases into Agandu or Nija. It's purely on the basis of the host response. The host response, the changes inside the host, does it happen before the infection comes, or does it happen after the infection takes place? So if it happens before, then the changes inside the body happens before infection, then it's a Nija Vyadhi. If it happens after the infection, then we could consider is it as an Aganduja Vyadhi. So with this framework, I want to give today some principles of how we will approach medical management of viral infections. I would indeed be very happy to talk maybe in the future about specific viral infections. It's not possible, because viruses are very different. And I want to point out why the same approach will not work in all viruses, because each virus has an affinity to a particular cell. In an Ayurveda, we would call this as a sthana. It produces a specific type of doshic imbalance. It disturbs Agni and different types of srotasas, and it affects Bala in a particular way. So each viral infection is for us a specific type of dosha dhatu imbalance. And so we need to actually look at each viral infection separately. It's not possible in a small 1-hour lecture to give a list of medicines that you can use. So today our focus is purely on principles. So when you look at the medical management of viral infections, we need to assess the dosha, sthana and ama. Each viral infection will exhibit specific dosha vaishamya, depending on which sthana of the body it affects. So the target of the virus varies from disease to disease. Now we are living and witnessing a pandemic which affects generally the respiratory system, and in some people also the gastrointestinal system. So there is specifically an affinity. So because the respiratory system is affected, we have to give importance to the sthana and also the doshas that are involved, vata kapha or pitta kapha. We have to really understand what kind of imbalance is happening in the body, and the choice of the medicines will be depending on that. And even in our ongoing pandemic, there's a lot of variation from individuals. Some people get gastrointestinal symptoms, some people get upper respiratory, some others lower respiratory, some others have generalized symptomatology. So from an Ayurvedic point of view, this clustering of symptoms is very, very important. And once we understand this pattern of the cluster, we can interpret it from an Ayurvedic point of view in terms of the doshas, in terms of the dushyas, in terms of the sthana, and that is what helps us to actually discover what is the specific medicine that we must give. In Ayurvedic texts, we have hundreds of thousands of formulations. How many do we use today? Just 300. So we have tens of thousands of formulations in our texts. They have anticipated that diseases will keep evolving, and they have given us, it's not individual herbs or it's not individual, prefixed formulations. That's why in Ayurveda, a medicine is called as a yoga. A yoga means a combination, which means for every disease, every patient that comes in front of you, by understanding what's going on inside the body, you will have to formulate, a new medicine. And that process of formulating a new medicine is called as yoga. So very virulent viruses. Why are some viruses not so problematic, and why are some viruses really so dangerous? This is because some viruses provoke all the three doshas, and then they create Sanipada diseases. So in the process, ama is also formed, and that ama may get converted into ama visha. So it's a very complex process. Simple diseases like cold, they are not Sanipada. That is why they resolve. So this is mentioned in our text. We will discuss that later. How do we understand whether a viral infection is Sanipadaja? The Sanipadaja viral infections are very dangerous because they may initially run a mild or moderate course or even a severe course, but after a point they suddenly turn worse and develop into a crisis. And from that crisis, either the patient recovers or he dies. This is exactly what is happening even in the present pandemic. This is exactly what happens also in all the epidemics that we have seen before, that in a lot of people it has a mild course and it recovers. Once the body fights the virus, there is recovery. And in those people where it goes into a complication, then there is a real crisis, and even with the best medical care, some people are not able to survive. So this Sanipada nature of certain viral infections actually makes it very dangerous. So this is why in our classical text it is said, Mrityuna sahayodhavyam Sanipadam chikitsata, that you are literally fighting with death when you're treating a patient who has a Sanipada imbalance. So now we will look at what are the key factors, what are the host factors that we need to really give attention to when we decide a line of treatment. In our talk today, that is all we will discuss. How by addressing, and why should we address these 5 host-related factors mainly, to equip the body to overcome a viral infection. So in the management of viral infections, these are the 5 factors that are of utmost importance, and these are Agni, Srotas, Sthana, Bala, and Dosha. So these are of utmost importance, and first and foremost is the Agni, which is the state of digestion and metabolism, and then the Srotas, the digestive and metabolic pathways, the Sthana, which refer to the different organs and regions of the body, Bala, the ability of the body to resist disease, what we would today call as immunity, and then doshas. Doshas are the self-regulatory mechanisms, which keep the body in a state of homeostasis and balance. So when the doshas are disturbed, then, the whole balance, the internal environment is disturbed and the disease process manifests. So these are, we can see that in a chart here, dosha is at the center of the disease process. So then we have Agni, Srotas, and when you may ask why dhatus are not to be considered, dhatu is also included in Sthana, and then Bala. There are many other factors, of course, which you consider in all other diseases, which should also be considered here as Kala, Satmya, Ahara, Even Prakriti needs to be considered. Even if every person is affected by the virus and if everybody develops symptoms, it's still not exactly the same. This is because of many other factors that are involved. But what I want to focus here is that when you create a formulation for a viral infection, these are basically the five factors that you have to always consider. And it is based on this consideration that you decide what formulations to use at what stage. You have to keep modulating. In certain situations, you have to give more importance to Agni, in certain stages, Srotas, sometimes Sthana, Bala, Dosha, but all the five need to be addressed at the same time. And as I want to tell you, so that you don't anticipate it, that today we are only going to discuss about the principles, because the treatment need to be discussed, with reference to specific viral infections. We cannot have a blanket approach for any virus infection. So these are the principles, and using these, if you keep these principles in mind, we will be able to make better use. We can choose more specific and many formulations which you are not using today, which can be found in our texts. If we follow this kind of a concept, we can develop algorithms with which we can use those formulations in a more specific manner. So we have to assess the Agni of the person. It's critical to maintain Agni of the body, which works through processes like phagocytosis, because we know that it is Agni which, the stronger the Agni, the more the Ama is digested. And this digestion of Ama is also part of the mechanism of clearance of the microbes that enter into the body. So this is why we say that fever should not always be suppressed. In Ayurveda, we never believe in, once you get fever, we don't believe that it should become completely normal all of a sudden, because the very purpose of fever is to create an atmosphere inside the body which is not actually good or conducive for the viruses or bacteria to flourish. So in Ayurveda, the whole focus is on bringing high grade fever to moderate level, and then slowly to mild fever, and then to an febrile condition. And that's why in Ayurveda we do not have strong antipyretics. Generally, it is not used. So unless it really becomes an emergency, and then there's really rise in temperature that can be threatening or very critical, I mean, there is really no need to suddenly bring down the fever. So this is very, very important, maintaining the Agni and slowly bringing down the fever step by step. There are elaborate methodologies mentioned, what type of medicines we have to use to deal with Agni, and this has to be decided specifically on the basis of the type of viral infection that we are dealing with. Next comes the srotases. The srotases really represent the metabolic pathways, and clearance of the srotases helps the body to actually fight the viruses and do the cleansing of the system. So Sroto Vishodhana treatment, there are medicines that enable the srotases to be clean. And we have to identify which srotases are affected. So SARS-like illnesses, the Pranavaha, Annavaha, Udagavaha srotases are affected. So medicines are targeted to keep these srotases clean. Like for example, in the Pranavaha srotas, if the disease moves from the upper respiratory to the lower respiratory tract, then the disease can take on a more virulent and serious condition. So this is the next concept of srotas which needs to be looked into whenever we are dealing with a viral disease. The third component is sthana, protecting and strengthening of the location where the disease is manifesting. So like in the present pandemic, the respiratory system needs to be supported. The sthanika dosha should be considered. So we know people who are young who have better kapha. When the kapha is not dushta, that is why we say prakritam tu balam shleshma. So in that particular sthana of the disease, if the kapha is strong and healthy, then the outcomes are better. But whereas in an older people, where the vata has increased in that sthana and the organ is not very strong, then we can have a very bad outcome. So the treatment should specifically focus on the sthana. This is another important principle when we deal with viral illnesses. And so these are the three points that we discussed first, that is Agni, Srotas, and Sthana. So these are from Ayurveda host related factors which we have to specifically focus on. There are many other factors which we are not going to discuss in this particular lecture. And then of course comes the bala. So preservation of the bala. Once a disease manifests with symptoms, we cannot do aggressive rasayana because we have to deal with the Agni, the Srotas, the Sthana. We have to also deal with dosha. So this strong rasayanas, of course we can give rasayanas also as support, but it cannot do its function. So bala has to be maintained, because as the disease progresses, the bala gets affected. So when we talked about sthana, there is also, when we consider sthana, we must also consider the dhatus. The strength of the dhatus is actually the bala of the body. And so bala should be maintained. So in the Jwara Chikitsa itself, Ayurveda says balam yatnena palayan, that we have to put extreme efforts to actually preserve bala. So maintaining the bala, we have to do the treatments. And also once the doshas have been pacified, then bala should be enhanced. And that is the stage in which the disease actually comes down. So balam hyalam doshaharam param tacha balapradam, it is said that when you enhance the bala, that alone is enough to pacify the doshas. So as we stabilize the Agni, maintain the Srotasas, and take care of the sthana where the disease is manifesting, when we do all this, we have to make sure that the bala is not compromised. So this is a very, very important element. And then we come to dosha. So the imbalance of the doshas need to be analyzed very, very carefully. Most of the epidemic diseases affecting the respiratory system, have a sannipata involvement. So viral infections that affect the respiratory system they are caused by the sannipata, or the simultaneous derangement of these three doshas, but with the dominance of vata and kapha. So these diseases, we can see they usually go over a course of first stage, as we are seeing in the present pandemic also, that the mild symptoms or moderate symptoms up to a certain stage, and then suddenly the patient goes into a crisis. So this is very beautifully explained by Sushruta. Saptame divase prapte dashame dwadashe piva punarghorataro bhutva prashamam yati hantiva. So on the 7th day or the 10th day or 12th day, it could be a little less or more depending on the host factors. So the Sannipata Jwaras tend to run a mild or moderate course first and then into a crisis. So this is what distinguishes the Sannipata diseases, viral infections which are Sannipata nature. A common cold is not Sannipata. That is why in a week it will resolve by itself. So this is why the Sannipata Jwaras require more support and more care, and which is why the death rate is also more. But even in Sannipata Jwaras, if it is mild and if it doesn't develop into a crisis, then the patient can recover. So these aspects, Sannipata, we understand something as Sannipata, especially in Jwara, not just because the signs and symptoms of all the doshas are seen. It's also because Sannipata Jwara runs this particular course of initially being mild and moderate, and then in some individuals it suddenly goes into a very severe and critical stage, and then the patient either recovers. So this is the stage of Sammurchana of the doshas. We can say that this is when the Sammurchana of the doshas have actually occurred, and there you create a stage of ama or amavisha. So the patient can go into sepsis or a septic shock. There can be very severe illness like pneumonia, which can be severe, hypoxia, and then what they call today as the acute respiratory distress syndrome, the ARDS. This is all the sign of a Sanipada Jwara of a Vata Kapha nature, which is going into a crisis stage. So the patient either recovers or succumbs to the disease. So this understanding of the dosha enables us to choose. So the success of treating a viral infection very much depends on which particular combination we have chosen. So this is where the whole challenge is. If you look at Vata Kapha Jwara, there are many options given in the Samhitas. So in a Vata Kapha, Kapha Vata or Jwara, you have Vyagradi Kashaya. You can also give Guduchi with Pipali Churna. So many options are given for the same dosha Vikalpa. So the challenge is how best you are able to fine tune it, and this has to be done for each patient. So it's not possible for an Ayurvedic physician to just treat the virus. This is what I wanted to kind of point out here. The way the virus interacts with the system creates a lot of deviations and variations. Symptom clusters are different. And the choice of the medicine has to be according to that particular dosha vaishamya which has happened in that particular sthana, and how the disease progresses according to these stages. It is considering that we have to choose the appropriate formulation. And in that stage, what we have today, they call this as a overdrive of the immune system. There is a sudden cytokine storm. The immune system itself overreacts and damages the system. This is a stage of a pitta manifestation. So in a Vata Kapha Jwara, the last stage when Kapha and has reduced a lot due to the activity of the disease, the pitta along with vata will come and cause destructive damage to the organs. And in this stage, ojas is very much destroyed, and then the individual, it's very difficult for the individual to survive this kind of a crisis. Even if the person survives, there could be a lot of residual kind of difficulties. So this is the concept that I wanted to introduce today. This is just an introductory lecture, the general introduction as to how to approach viral infections. So let us summarize what we discussed. Virus is, from a modern point of view, it is just the boundary between the living and non-living. It's genetic material, but it cannot replicate or it cannot grow when it is outside a living system. But once it enters into a living living form, then it has specific affinities to specific cells, and once it enters into the cell, it hijacks the genetic mechanisms of the body and then replicates itself. And we discussed that millions of viruses can come out of one cell, and this is destructive. The viral load can increase in very big proportions in a short period of time, and then the immune system of the body is overwhelmed. If the immune system is strong, and then the body is able to meet this crisis without going into an immune overdrive, then there is a chance of good recovery. And this is exactly what Ayurveda is looking at. We discussed that the concept of virus, the behavior of a virus, its classification, in fact even microbes, into the sahaja and the vaikarika has its echo in the modern concept of the good bacteria and the bad bacteria, the human virome and then the pathogenic viruses. So this distinction is seen in the Ayurvedic concept of krimis. And we discussed also that all infections are not necessarily aganduja, because some infections in that dosha vaishamya has to first happen in the body, and after that the infection comes. Whereas in other infections, the disease process is initiated first and then we see the dosha kopa. So there is a period of incubation in such diseases where there is no dosha kopa and the individual remains healthy for some time, no signs, even they may be testing positive for the virus. So this is why we consider these kind of infections where there is an incubation period. It takes time for the doshas to get disturbed before the disease manifests. Such diseases we are calling as agantu, and so viral infections are agantu. And from this point of for prevention point of view, we really need to look at all the measures of avoiding contact, gatra samsparsha, prasanga, nishwasa, sahabhojana, and all those things are very important. And bhutadya sparshanopaya we discussed, and even Sushrita goes to the point of saying, I mean, not only social isolation but also lockdown, not going to the staying away from places where this infection can manifest. All this is important when we look at it as agantu. But once the disease process is initiated, now it behaves more like a nija disease. There are variations from individual to individual, and then we need to focus more on the host factors. And this is the key point. Even if it is one virus, we must always understand that viruses have this tendency to mutate depending on how it interacts with the host. And which is why in Ayurveda we say, more than what is the virus, we need to focus on what dosha Vaishamya has happened in the body. In different individuals, these 5 parameters, what we discussed, the 5 elements of the Agni, the Srotas, the Sthana, and then the Bala and the Dosha, these are in different conditions. And it is the interplay between these 5 factors that actually determines whether the disease will become severe, mild, or moderate. And today this is very important. There are other additional host factors like Prakriti, Satmyam, then there are Kala and Vaya, all these parameters which we have not discussed here, but these 5 are very, very critical. So if you were to look at these 5 parameters, then each individual is treated differently. And so if you ask, is there one medicine or one formula or one herb for a particular viral infection, that's not the way it works. I think that's where we have been making this mistake. We are looking for 1 or 2 formulations which can deal with a viral disease. It doesn't work. If we have a set of herbs, and if you know how to combine them according to each patient, then the outcomes will be much more specific and effective. So this is the Ayurvedic approach to deal with viral infections. And I want to point out that yes, why are we not successful? I will show you 1 or 2 examples where there are simple herbs that we are using today which are already known to have antiviral properties. But if we use them alone, we are not getting the result. Like for example, let us look at Tulsi, the holy basil. This is shown to increase immunity, and it's well recognized that it can fight viral infections. In a 4-week study in 24 healthy adults, 300 mg of this holy basil extract increase the levels of helper T cells and natural killer cells, both of which are immune cells that help and protect to defend your body from viral infections. But we know that just with Tulsi we cannot manage all viral diseases. That has been the mistake that we have been making. We are picking up one herb, or this is studied in a single way, because unless we target all the 5 factors, all the host related components, these major 5 factors plus many other components which are essential, we will never be able to create, tip the whole equation in favor of the host. And that is why combinations are needed. Individual herbs are very promising, but they are only bits and pieces. When we bring all these bits and pieces into the form of a complete formulation, this is something which we have to discuss, in another lecture, with example to a particular, viral infection. Then it can be illustrated. We cannot do that in a general kind of discussion. So we also have licorice. Licorice has been used in traditional Chinese medicine and other natural practices for centuries. So some of the components of licorice, that is glycyrrhizin, liquidity, genin, and glabridin, are some of the active substances that have powerful antiviral properties. So many studies, even in vitro studies, have shown that these are effective against HIV, RSV, herpes virus, even the SARS-CoV virus, which caused the SARS, and which leads to this kind of acute respiratory distress syndrome. So this licorice is also showing promise. But the whole question here is now, how do we look at the key factors in a particular host? How do we understand how the virus interacts with the system, and how do we formulate the right combination of herbs? That is where all the work and research has to go. And if we take that approach, we will be able to identify the key herbs which should be used in a particular doshic response to a viral infection. And then we must learn, we create an algorithm of how to combine these herbs in different ways, for the different subsets of patients who come with a particular viral infection. Then I think we will be closer to discovering a way to manage viral infections. We are doing this in our clinical practice. A lot of time we get results, but when there are very virulent or new viruses, sometimes it takes time for us to understand and discover the real method of formulating these medications. So I wanted to conclude by saying that these kind of respiratory illnesses that cause epidemics were anticipated even in ancient days. Charaka has mentioned about epidemics, but Sushruta is sometimes really, really very specific here. He says that yo deshas tatra dosha prakritya visheshena kasashvasa vamadhu pratishyaya shiroruk jwareru patapyante. So this syndrome of, this cluster of symptoms that he talks about, we have been seeing it coming back again and again in different forms. So it may be SARS, it may be swine flu, it could be something or the other. Sushruta has said that it's almost always going to be almost the same set of symptoms, but because the virus mutates, because the human body will also respond differently, the symptoms and presentations keep changing. So that we also need to keep combining these herbs in newer and newer ways to be able to match the genetic mutation and the interactions with the host in the human body. So this is the way we would be able to deal with viral illnesses. So this is very interesting. Sushruta says that irrespective of the constitution, all people in a particular region begin to get affected by this cluster of symptoms: cough, breathing difficulty, or these are respiratory symptoms. Lower respiratory, then you have upper respiratory pratishyaya, which is rhinorrhea, and then vamadhu or vomiting, and then headache and fever. So we can know that these Sanipada kind of respiratory epidemics have all presented with these symptoms in different ways. And so Sushruta says this is due to Raksha, Krodha, Dharma, and all these other kind of, problems which affect all the people in a location, in a similar way. So then we call this as an epidemic. So this is a brief, introduction to the Ayurvedic approach to deal with viral infections. Of course, today we discussed only the general principle, and the main key takeaway point is that even if the disease is caused by a virus, of course, we can also look at medicines which are antiviral or directly attack the virus. That's also another topic for discussion. But one of the key strengths of Ayurveda is that we have measures, we have understood, this whole complexity of the host and identified those key factors modulating which we can, prepare the host to deal with the viral infection in a more successful way. So these Ayurvedic treatments, because many of these viral infections, they are self-limiting anyway, and by using Ayurvedic medicines, we can prevent it from going into a more severe stage, and we can also speed up the whole process of recovery. So thank you very much. I hope this discussion was able to throw some interesting ideas on how we should look at viral infections. Thank you.